Good afternoon, everybody, and thank you all for joining us for this week's update. I'm Dan Kuntz, Director of Professional Development at the Missouri Society of CPAs, and I would like to thank you all for coming to today's program. Well, another week has passed, another package has passed, and I hope everybody is staying safe. Some are predicting the virus may be nearing its peak in certain markets, and others still have some time to go. The real question remaining is what is the total impact of the pandemic and when to anticipate a recovery? And this session will hopefully give us some insight into that. We are continuing to provide you with the resources that might hopefully help you get through these times a little bit easier. Please take a minute to look at the resource page on our website, where we continue to post the latest news and additional opportunities, as well as past updates from this series. I encourage all of you to read the emails we have been sending to our members every Friday. And please, don't hesitate to reach out to our staff for anything that you might need. One of our most trusted partners and advisors over the years has been Chris Kuehl. Since the pandemic hit, we have been in talks with Chris about informing our members. From that conversation, this series was developed, and we have spent the last 3 weeks together. I encourage all of you to read the daily business intelligence brief and Chris's article in our upcoming May asset publication. We truly appreciate his partnership, and I know what we learn from these sessions will help us all in guiding our businesses. Without further ado, I'll turn it over to Chris. Thank you.
All right, thank you very much. And here we are again. It's becoming a Friday routine. I am not deliberately trying to be optimistic. I'm not to be unrealistic, but there seems to be a little more good news showing up right now than bad. So I'm going to seize the opportunity to go into the weekend with a little more uplifting message than maybe we've had in the last few weeks. So as we've been talking about from the very beginning, this is a black swan event, and maybe now the black swan is being outnumbered by white swans who are beginning to reassert themselves. We can only hope. So we'll talk about that as we go. So we know already where the impact has been. This is kind of a reiteration of where we've been the last few weeks. And it's critical to understanding how the recovery will play out, because there's a couple of dynamics that have to play. You know, the big issue, of course, has been declining consumption. And I've said this all along. This is a weird recession. It is a manufactured recession. It is a lockdown recession. We've never really had anything quite like this because nothing set it up economically. This was not like what we went through in 2008. It was not something like we went through in the 1980s. It's not been like any recession because it wasn't created by an economic crisis. It wasn't a breakdown in the bank sector, which is what happened in 2008. It was not a reaction to rampant inflation and Fed action back in the 80s. This is something where, in order to deal with one problem, we created another quite deliberately. We knew this was going to happen, and by we, I mean everybody. Every country in the world has done this. So it's not that the U.S. has been unique either in how it has responded to this, and not even particularly unique in terms of how it's played out. The critical thing now is that when business starts to come back to life, it will actually be the riskiest moment it has gone through thus far, because when business was shut down, it was, of course, very, very bad from the standpoint of having revenues and all that, but it also meant that their costs were going to go down. You know, during that period, they fired their workforce. They didn't buy any more raw materials. They didn't buy any more inventory. They were shut down. So they weren't spending any money. They weren't making any money. Once they reopen, they'll be spending money again. They'll be hiring people, hiring hopefully the people that they used to have, hire back the ones that lost their jobs. They will be buying inventory. They'll be buying raw materials. They may be investing again. They will then count on the consumer to come back and provide the revenue to justify that resumption of cost. So a lot of businesses that survived the month or so out of business are going to be even more nervous as they come to life, hoping that they get their customers back. We as consumers are going to have to pay attention to this and do what we can to resume our patriotic duty, which is spend money. That's what we do best. We are, after all, the consumer that says, I can't be broke, I still have checks. We are the Investment will follow consumption. We have definitely seen a lot of investment decline, but the markets have already started going back to some of that volatility. They're up on some rumors, they're down on some rumors, and we can tell just how weird the rumor mills have been. I mean, earlier this week, I laughed out loud. There was a rally in the oil markets, and at first I was like, okay, why? I mean, we're going to talk about oil here in a minute, but the demand for oil hasn't gone up. It's as bleak as it's been since this whole thing started. What was it that the oil markets found so enlightening that day? And it turned out that they were responding to a statement that came from the Trump White House that if the Iranians attempted to attack an American warship, they would be destroyed. And I'm like, okay, this isn't a new policy, This is a policy that's been in place for about 225 years. This is the same policy we had in the time of the Revolutionary War. If the British attempted to attack an American warship, we would attack back. But the oil markets were so desperate for something that was even remotely encouraging that they seized on this as somehow significant, despite the fact that it didn't change a thing and it affected Iran. Iran isn't even a factor right now. They haven't produced for weeks, and they're up to their eyebrows in COVID-19 cases. So you get a sense for how volatile the markets are right now. We have certainly seen a lot of government expenditure. We just had another $500 million, or $500 billion thrown into the mix, trying to bail out small to medium-sized businesses because the money that was originally provided ran out, which we knew it would. I mean, you shut down all businesses, you're trying to replace a $25 trillion GDP, which is going to be hard to do. The notion is that this is probably the last big infrastructure-oriented contribution. There may be extensions of some other programs through the summer, but that's kind of dependent on how things shake out in May and June. And then, of course, our exports continue to be down because nobody else has any money either, so they're not buying anything we have to sell. So where are we in terms of kind of the pandemic? It's about where we thought we would be. The University of Washington has been sort of on top of this from the beginning because we kind of remember back in February or so that our first real inkling that we were going to be dealing with COVID-19 on a grand scale was in Seattle. So Washington jumped into this pretty quick. Their expectations based on their models were that most states would be reaching peak by this week, end of last week, and into next week. And we're pretty much on target for all of that. Most of the states are seeing different peak performance, and it's dependent on how much of an urban area they have. It depends on their coastal location, et cetera. The other thing is just defining peak. There is peak in terms of fatality. There's peak in terms of infections. Most of what people are worrying about are the hospitalizations and the fatalities. We don't really know how many people are getting the disease because we're still in this weird position where half the people who get COVID-19 are not even aware that they have it. So we'll talk more about that in a minute. The University of Washington also did a projection as far as when states would be coming out of the lockdown. And this is considerably less scientific because it really is going to depend on the decisions made by each of the state governors. We now know that this is going to be a state-by-state situation. They will follow federal guidelines to a point, but most of them are acting pretty independently. And it's difficult times to predict where they are going to be. For example, in this chart, University of Washington had Georgia being one of the last states to open up, and that was based strictly on the amount of disease that they had identified. They were relatively high in terms of hospitalizations, relatively high in terms of fatalities. It did not look like they had peaked yet, and so the assumption was that they were one of the last. Well, of course, we know they weren't. They were one of the first. And Governor Brian Kemp just decided to kind of turn his entire state into a lab rat. If it works and Georgia is able to come back to life with a minimal increase in hospitalizations and infections, that's going to be sort of a blueprint for other states to do the same. If, however, you see a spike and the second infections become an issue, that's going to be a warning as well. And it's going to tell other states that, okay, doing this prematurely is not a good idea either. We honestly don't know. I mean, there's a lot of factors in terms of how something is going to spread. The countries in Asia and Europe that have seen secondary infections, they have identified that for the most part, they're coming from outside, that as they would control what's happening with the existing population, they were still at risk as people came home. This was a big issue in Singapore. Singapore was on top of it for quite a while, then had a big secondary explosion because so many people in Singapore work outside Singapore. And as they were making their way back home, they brought the disease with them. You know, we had the announcement from the Trump White House about restricting immigration, which is okay, except that that's not really who we're worried about. We're worried about Americans who you can't restrict coming home from wherever they were. For example, we have seen 490,000 people coming into the United States from China who are all Americans. They're not Chinese, they're not immigrating, they're not moving, they're Americans coming home. And there's nothing you can do to stop them from coming back home. They're citizens. So that's been an issue with a lot of countries, is kind of dealing with its returning population. So here are the numbers. We've run through these a couple times already, and these are the more or less latest. We're now looking at about 2.6 million cases worldwide, about 728,000 recoveries. And by recoveries, this is generally people who have been hospitalized or under medical care who are now released from the hospital in medical care. It does not count people who had a very mild version and maybe never reported it at all, or if they did, it was kind of, yeah, I got it, and I'm taking over-the-counter stuff, and I'm fine. We've seen around 185,000 deaths worldwide, about 47,000 of them in the U.S. 96% still of the cases have been judged to be minor. That hasn't changed much. If anything, it's been a little bit higher as we do more testing, finding people who are asymptomatic. And so they're obviously experiencing their versions of it, and we're just now catching up with them because we're testing them. We are seeing about 144 deaths per million. In contrast, Spain is at about 474, much worse than us. Germany is at around 40, 39 to 40. Serious condition, 14,000 in the U.S., around 4.5 million tests. The Germans are still a little bit ahead of us. We're testing about 13 million or 13,000 per million. Germany is at around 24,000 per million. If you want to go to the most tested country on the planet, this is one that is now up to 180,000 tests per million. It would be Iceland. So Reykjavik is nice this time of year, and so if you want to go hang out in a hot pool, that's your big chance because they know who has COVID and who doesn't. We've seen around 84,000 recoveries in the U.S., active cases around 700 to 17,000, and then again, the number of people out of work, 25 million and counting. We've mentioned before that you've got two different categories of worker caught up in this. There are those that have essentially been furloughed. That's still around 80 or 85% of those who have lost their jobs. And the presumption is that when their companies come back to life, whatever they happen to be, they're going to rehire the people that they were forced to lay off. Many of the people were actually told that, and we're indicating that you just have to get through the next or two, and then when we reopen, we'll hire you back. What's a little concerning is that the latest numbers, the people who are just now being laid off, those may not be furloughs in the same proportion as they've been in the past. They're often being laid off because the company they work for has actually shut down now, or is to the point where they have been so damaged that they are reducing their footprint. They're closing branches, shutting down operations. So a little more recent unemployment numbers are a little more serious because these people may not be in that furlough category. Another question that's come up a lot, and might as well deal with it now, is the number of people who won't go back to work because they're getting sufficient government aid to keep them from having to do that. They're getting unemployment, they're getting an additional $600 a month. There is a category of worker that is most vulnerable to that kind of behavior. They're referred to generally as transactional workers. And every company or most companies have a certain percentage of their workforce that falls into that transactional category. These are people who do not think of their job as a career in any way, shape, or form. They are completely motivated by the paycheck that week. They're the ones that have always been the high turnover worker. They will leave your employee if somebody offers to pay them 25 cents an hour more, or 25 cents a week more. I mean, it's the job. They're going to take the time to look at what they're earning and say, okay, if I'm making this much money from the government and this is how much I make if I go back to work and I'm making more money sitting home, I'm going to sit home. The vast majority, 80% or really closer to 85 or 90% of workers are not transactional. They are aware that if they stay with the company that they're working with, there's the potential for raises and promotions and the opportunity to learn skills. They're sort of looking at this more in a career sense. They don't want to lose contact, and certain jobs are stickier than others. So if you have employees that are also enjoying benefit packages and retirement packages, and they have an opportunity to increase their wages later, they're not likely to resist going back to work. The transactional worker very well might, because they're, like I said, they're motivated by that immediate paycheck, and that's really about all. So we know who's vulnerable in terms of the disease. That really hasn't changed. It's still a much higher fatality rate with people who are over 60, in their 70s, 80s, and like, than for those that are under. We are now learning that the younger populations are vulnerable predominantly because of lung issues. So people who smoke, people who vape, people who are in some way or another compromised, asthma. Even though asthma has not been as big an indicator as we thought it would be, a lot of people with asthma have not contracted COVID-19 and have not really experienced any worse symptoms than anybody else. Obesity, on the other hand, has been a problem. People who are contending with obesity, and yet we don't really know the details there. We're not sure if that's possibly connected to being diabetic or pre-diabetic, but we just have noticed that people who are in better shape survive better than people who are not in particularly good shape, but that really can be said about almost any disease, any ailment. So we're seeing the trajectories go in the direction we want. This is good. China is definitely in the bell curve with the decline very obvious. You see it with South Korea. You're seeing it even with countries like Iran, Italy, those that have been hit pretty hard. The data, and I've mentioned this a couple times before, originally the data coming out of China was not all that reliable for the first 2 or 3 months. I mean, January, February, even into March, there was a lot of question as to how accurate it was, how much China was trying to fudge the numbers, and they clearly were. Since about mid to end March and throughout April, most of the data coming out of China is now coming from the international health community because everybody is there. CDC is there, the Japanese are there, the Canadians, the Europeans, the Australians. I mean, the Filipino Ministry of Health is active in China trying to figure out what's going on. So we're now in a much more accurate place as far as the numbers are concerned. We're beginning to see the downturn even in European states that were hit fairly hard, like the UK and Italy. We are just now sort of getting to that point in the US. Our daily count was up pretty high, but has started to level, and that's good news. Even better news is that we're seeing a real urban areas in Europe or in the United States. I mean, New Jersey is trending down, New York is trending down, it's trending down in Michigan, Illinois, Texas. all of our urban cores are now beginning to see a decline. And that's good news because the challenge with COVID-19 has always been contact. And it's hard to avoid contact in an urban area. I mean, I was participating in a call the other day, and most of the other panelists were from urban areas. They were from New York, and they were from Washington and Boston, and they were all talking about how difficult it was to resume daily life because of the dependence on mass transit. You had subways and buses and trains and all that, and they finally got around to asking me, what was it like in Kansas City? And I said, well, we have a train. It goes 6 miles and then turns around and goes 6 miles back. We don't have subways. We have 3 buses. And mass transit in Kansas City is more than 3 people in your truck. I mean, we're not a city that is set up for mass transit. We don't have those kind of groups. We certainly do have group circumstances, and those have been the ones that have created the most problem. But cities that are more lightly populated or don't have those kind of mass transit complications are the ones that are having a little less trouble with the spread of the disease as opposed to communities where crowding is hard to avoid. The pattern has been emerging for quite some time, and we now see it pretty clearly. The number of deaths has switched from Asia to Europe. Now it's leaving Europe, and it's becoming more of a problem in the U.S. Next up will be Latin America, and possibly parts of Africa, parts of South Asia. I mean, India is now dealing with a much bigger problem than it was even a week ago. Showed this slide once before. It's still the issue. This is a matter of trade-off, and as we begin to explore reopening in May, this is the only question. We know that as we reopen, we're going to risk more infection. There's just no way to avoid it. You're going to have people having more contact with each other. That was the whole idea of flattening the curve. We know that if we don't open up the business community, the economic damage will become irreparable. You will have companies that simply don't come back, aren't in a position to hire people. There will be so much loss of economic momentum that it would take us years to recover. So we're still stuck in that rock and a hard place situation where we're going to have to learn to accept damage in both situations. We're going to have to realize that we will still have the virus to deal with even after we reopen. We're also going to have to realize that as we reopen, we're still going to have to pay attention to containment. There will have new protocols. We'll still have restrictions on what we can and can't do. There will be calls for people to self-isolate. There will still be calls for people to take personal hygiene a lot more seriously. It may be a very long time before we open up completely to things like concerts and sporting events and parades, any place where you have an uncontrolled population that's going to be interacting with each other closely. Reopening a store, not such a big deal. We've known how to do that now for a month and a half. Even reopening restaurants. The restaurants that are discussing reopening are saying, well, for one thing, we're going to seat people a lot further away from each other than we used to. We're going to take extra effort to be sure that our staff is practicing good hygiene. We're going to be, one restaurant was saying, yeah, well, in the past, we made sure they had silverware and forks. Well, now we're going to make sure they have Clorox wipes along with all that because we need to pay attention to those issues. We have seen a lot of countries doing the same sort of thing we've been doing as far as stimulating. The Germans have kicked in 800 some odd billion, 400 billion, French somewhere around 500 billion. Everybody is doing the same basic thing we're doing. And they all have the same limitation. None of this really works until the consumer gets re-engaged because this is all designed to stimulate consumption. It's all designed to get people spending again, put money in their pockets, which they can't do until things begin to reopen. So there's a kind of a collective holding of breath saying, okay, once we open, come on, consumer. The consumer is going to have to take that leap. And the polls indicate that we're kind of in three categories. There's 1/3 of us that are going to come out of this like we have been in cabin fever land for the last 2 months. We're going to just embrace our old life enthusiastically and go out to eat again and shop again and look for every opportunity to get outside. 1/3 of us are going to continue to be very worried and will continue to isolate and will continue to avoid contact and won't go out unless they have to. So it'll come down to that middle third. If that middle third feels assured enough to start coming out, then you now have 2/3 of the consumers ready to spend. That middle third is looking for a definitive statement from somebody that they trust. And that has been a challenge in most of the countries around the world, including us, because there's contradiction. Not all the states are on the same page. We don't always hear the same message from the federal level. You know, you've got some people saying, you know, we're to break free, other people saying we're not. We've not seen consistent messages from the White House, and it creates unease. People don't quite know. The Germans, on the other hand, have had a pretty consistent message, and they were asked in a poll, why was that the case? Why were the Germans more willing to listen to their leaders? And the bottom line, and it came back in the polls, was the Germans said, well, you know that Chancellor Angela Merkel was a scientist for 25 years prior to becoming chancellor. So if she says to do something, we trust her. She's a scientist. And one of the things that has been encouraging is that some of the breakthroughs are coming out of Germany. There's a German company that's been working on a vaccine since January. They have now started human tests. The human trials began this week. They've got about 500 people in the trial. It has been working spectacularly in the mouse trials. So they now seem to be the furthest along in terms of having a vaccine, and this company thinks that this will be ready by the end of summer. If that's the case, they already indicated they are planning to share the technology with everybody else, with the US, with Japan, with anybody that's been working on the vaccine as well. So the Germans are sounding encouraged, like this is on the cusp of being susceptible to a vaccine. And the good news, which they discovered a couple weeks back, was that this particular virus morphs a lot slower than flu does. So where flu, we have to come up with a new virus every year and distribute a new virus every year. This is a vaccine, at least at this stage, that could be administered and would be protected for multiple years, maybe as many as 5 or 6. So then all of a sudden, you're only having to vaccinate people every 5 years. That's the most optimistic version of this. There are probably inhibitions that would slow this down. Most companies have been affected. The vast majority have indicated that their revenues are down more than 10%. That's a significant disprovement, whatever. It's a lot worse than it was 2 weeks ago. The stock market has been bouncing all over the place. We talked about that earlier. Very much back to its volatile areas, not back to its normal numbers. And, well, depends. Normal numbers becomes relative. The market has been so kind of overextended for so long that we've left normal behind a number of years ago. But it is at least behaving the way we expect markets to behave, up one day, down the next. The kind of jobs that are vulnerable, it hasn't been a big shock. These are mostly service jobs and mostly jobs that are sort of in the category of relatively low paid. You know, food and beverage, clothing and retail, automotive, education, travel, I mean, all the things that you'd expect. In the 2008 recession, the majority of the impact was on high wage jobs, because that was a financial sector recession. We know what happened. Bear Stearns went out, Lehman Brothers went out, WAMU went out. You know, I mean, everyone in the financial sector was affected, and it took a lot of high wage jobs with it. Most of the jobs that have been put at risk at this point are lower wage jobs, though that is changing. In the last week or so, there have been more senior positions caught up in the layoff and or furloughs. If you look at what's going on with, here we go, with the airline industry. It's like not good. And one of the questions that will be asked when this is all over is an awful lot of rules and regulations that made sense once may not make so much sense now. The airlines have been required to continue to fly their routes if they want to hang on to those routes. It's part of the rule. Even though at the moment they are flying airplanes with nobody in them. So one of the reasons the airlines are in such trouble is that they're still spending money like crazy and there's no revenue. So one of the conversations will be that if there's a situation like this again, can the airlines just stop flying certain routes or limit or in some way respond to the outbreak? Right now they've not been able to, and that's one of the reasons they're in such trouble. There's an estimate 30 something in the range of 30 billion or so that's going to be thrown at the airlines from the support from the federal government so that they can get through the period. If you look at which states have the most jobs at risk, much of this is pretty predictable. I mean, Nevada is at the top of the list, Florida is at the top of the list. It was a little surprising to learn that Montana is highly dependent on retail, leisure, and hospitality. And it turns out that that's one of the biggest industries in the state because it's a lot of vacationing takes place in Montana. If you look at the rest of the country, Missouri is relatively vulnerable, Kansas is a little less so, and some of the other Midwestern states have more dependence on things like manufacturing or some other motivation for their economy. The impact on tourism is much more severe than it has been before, but this is also a sector that could recover relatively quickly. Timing will make a big difference. It's the summer. The summer is the point when people start traveling. The initial suggestions coming out of groups like AAA and some of the others is that people are still planning a vacation at some point this summer if things get better. But overwhelmingly, they are talking about driving rather than flying. So people are still not going to be jumping back on airplanes anytime soon. The driving appeals to people, A, because it's a little safer from an exposure point of view, but B, oil prices are so low. I mean, so if you are going to drive cross country, I mean, you know, with gasoline prices in some parts of the country at $1 a gallon, it's an incentive on the road. There's even been an indication of increased sales for campers, and because again, security. If you're going to travel, well, if you can stay away from hotels, which you don't yet trust, and you can stay away from airlines, which you don't yet trust, well, just jump in your window and drive it. And it's been intriguing because generally speaking, the destination for the campers would be state parks and national parks. But Walmart has already indicated that it is making it known that it's going to have the same policy that it has when there's a NASCAR race in the area. And if you've ever seen what happens to a Walmart parking lot during a NASCAR race, people park there for the race because then they can go get their stuff at Walmart. And Walmart is like, if you're vacationing in your Winnebago, by all means, park in our parking lot and then shop here for later. So there's going to be a lot of creative discussions in the retail community here in the not too distant future. There's been a surge in remote work. We'll see how long this lasts. Initially, the response to working remotely was really high. I mean, people were like, wow, this is awesome. I'm going to work from home and I'm not going to change out of my pajamas for weeks. About a week or two later, the attitude had begun to change and people were like, I am so bored, I can't stand it, and I want to go back to my work friends, and I want to go back to getting my coffee at Starbucks, and I don't want to work from home anymore. There have been some pretty clever, unique approaches to making the work from home more pleasant. There is a company that is now selling mannequins that you can distribute around your house so that they can represent the people that you can't see right now, family members and friends. I was talking to Dan before this started. I think I'm going to get 20 of them and put them in my office, and I'll have an audience. and then I can pretend that I'm speaking to people. I was mentioning that to somebody earlier today, and he says, yeah, but they won't have the expression and stuff that you are used to. And I said, well, I'm just going to pretend that I'm speaking to engineers. They all just sit there and stare at me too. So it won't be any different from those talks. I can say that my father was an engineer. So I know all about the range of emotions for an engineer. They go all the way from A to B. So recovery still depends on timing. I've showed you this before. A little bit of a variation because this one throws in the potential for a fall resurgence. If we get the May reboot, we are looking at a recovery that pretty much brings us back to normal by the end of the year. If we don't get the recovery until closer to June, then we still get the recovery pretty close to what we would have gotten with May, but it would be a little bit slower. And then there's the potential for the COVID resurgence a little bit later in the year. Fall recovery reduces the opportunity for resurgence because we've extended the containment a little longer, but it also creates a much slower rebound. But the good news is that the fall recovery would probably bring us up to a slightly higher recovery level than the summertime recovery, if only because you reduce the risk of having to reimpose containment strategies later in the year because the virus was not as defeated as we thought it was. One of the interesting assessments, and this is something that's been coming from a variety of economists who have been sort of assessed with this, look at what happens with both the worst case and the best case. Worst case scenario, we get a tremendous drop and we end up with a dramatic negative period for world growth. But then it rebounds to be about where it was with the best case. So worst case or best case, we're back to growth by 2021. Look what happened in 2009. We got the rebound in 2009, immediately slipped again. So we came very close to getting a W, where you would have a recession following upon the other recession, because what we did get after 2011 globally was really mediocre growth until around 2017. That's why I keep pointing out that the 2008 recession is still worse than this one. This one is one that sort of has a time limit on it. It is one that will end when the lockdown ends. How quickly it recovers from the lockdown is still an open case, but the conditions that existed before COVID-19 are still there. The economy is still fundamentally healthy underneath all this if it can recover that lost momentum. Same kind of illustration with this particular assessment. This is from another set of world growth estimates. Again, whether it's the worst case or the best case, they all kind of end up at the same place by 2021, that we end up back around 4% growth. Not the greatest in the world. World growth has been much higher than that in past years, but at least back in respectable territory. And then finally, you kind of look at the institutions would have to put their money where their mouth is. Goldman Sachs, JP Morgan, Morgan Stanley, almost all the major banks, they're all expecting a V recovery with recovery in quarter 3. So by the time we get through the summer, we're back and look at where it's expected to end up, much higher than it was when we started. This is the expectation of a boom following a decline. All comes down to the consumer again. All comes down to what businesses do. You've sort of got two scenarios setting up. If the consumer behaves the way the consumer has always behaved, there will be a boom. People will be very, very grateful to come. It'll sort of be the massive equivalent of a bad storm year. You know, those of you who follow weather and economics, whenever there's a miserable winter and people are locked into their homes by massive snows and ice and all that stuff, when spring finally arrives, people go nuts. It's like, yay, I can go outside again. I can plant things again. The world is back to normal. We're sort of in a position where we could experience a viral version of this, so that when the pressure is lifted, we are anxious to go back. How long that lasts depends on whether or not there's a secondary outbreak. If we all go rushing back to our normal lives and then immediately fatalities and infections rise again, then all bets are off. But it has so far been the case in most countries that have had the rebound that these secondary infections have been less threatening, partly because people now know what to look for and the testing catching up. People who are vulnerable know by now they are vulnerable and are going to be a little less cavalier about exposing themselves. People who suspect that they have had exposure are now in a position to get tests. Not all of them, and still a long way from being complete, but it's better than it was when we started. So I leave you with this, then we'll take questions. I have to confess that I'm beginning to resemble the one on the left. It's kind of like, I didn't think that I was getting that much exercise walking through airports, but getting my Fitbit right now keeps sending me messages like, are you dead? Are you still moving at all? So I keep having to reassure it that yes, I'm still here. And then something about this whole thing has just made me think of Monty Python again, and there's something that's kind of Python-esque about all of this. We shall see. So as we wind up, Dan's going to field questions for me and throw them my way. Anybody who wants to send questions another way, just feel free to email me. I'll be glad to answer them offline, and call me, whatever you want to do. Most of you are getting the VIB through MOCPA already, so just keep reading. One of these days, I promise, it will not be the plague report anymore, and we'll actually be able to write about something other than what's happening here. And then Dan had mentioned at the beginning of this that people wanted to talk about oil in a little bit more detail. And so I'll assume that's the first question. The oil situation is going to get interesting. We are right now dealing with absolutely no demand, and that has caused production to literally halt. There's no place to put the oil. Every tanker truck, every ocean tanker, any place you can possibly think of to store oil is now storing oil. So there's no place to put any additional production. That will mean that everybody shuts down, not only here, but also in the Middle East and anywhere. That sets us up for when we get that V and we start to recover, and if we recover as fast as we're thinking we might, demand will spike. And when that happens and there's no production, oil prices will jump really high, really fast. So one of the things I think one can count on right now is oil prices in the $100 to $150 range by fall. So right now, it's 14 bucks a barrel. It's not going to stay at 14 bucks a barrel. And if you've got the capability of putting an oil tank in your backyard, you might want to do that now. Toilet paper will be a lot less useful, but oil and gas will be more useful. So any other questions, Dan?
Yes, Chris, thank you very much. And a quick follow-up to the oil one. Will transitions to renewable energy be slowed or halted because of the rock oil bottom prices?
Yeah, I think you'll probably see a little bit of an interruption of alternate technology. But as I said, we're going to hit high oil prices again in the coming months. And that may prove an incentive for more electrics and more alternatives, because people will be reminded, as they seem to have forgotten, that oil prices are volatile. And for the last several years, we've been saying, well, who needs electrics and all that stuff? Oil is going to be stable. It's been stable for a long time. It's 50 to 80 bucks a barrel. No big deal. Let's not worry about it. And all of a sudden it's, understand that oil is an inelastic good, and it is going to respond to the events of the time. So by fall, people are going to be like, Oh, let's get back with those electrics again, because look at the price per barrel of oil, because it's going to get high and stay high.
Perfect. What is happening in Russia and North Korea with the coronavirus? They seem to
Yeah,
be quiet.
the Putin regime was for quite a while part of what's been referred to as the Ostrich Alliance. These have been dictators that have somehow concluded that if you don't talk about it, it doesn't exist. The Ostrich Alliance right now consists of Turkmenistan, Nicaragua, Belarus, and Brazil, of all places, and Russia was in that category too long ago. Putin denied that they had any COVID-19 infections, and now they're admitting to us, well, yeah, okay, we have millions, all right, so, we were lying, but now we're admitting that we have a problem, and we don't have enough hospitals, we don't have enough testing kits. Russia's rapidly getting to the point where it's going to be one of the higher fatality countries in the world. They just don't have the infrastructure to deal with this. They don't have enough hospitals. They don't have enough medical personnel. They don't have enough tests. Admitting that they had a problem was also an admit that we're not ready for this, and it's going to hit us hard. North Korea has become an interesting situation. We don't know anything about how the virus is playing out in North Korea because no information comes out of North Korea at all. What we do know is that the chairman, little Kim, is apparently in bad shape. He's had health problems for a long time, and this has been basically known. He has been hospitalized many times before. No one has admitted exactly what the issue is, but those who have observed North Korea and observed him say, well, to be honest, it's fairly obvious what his issues are. He's very overweight. He is behaving as a severe diabetic and is probably in a world of hurt right now. He went through some kind of an operation, and it was not very successful. And unfortunately, we know that people who have diabetes don't do well in many of these surgical situations. It's very hard on the body. So certainly North Korea is beginning to kind of drop hints that there may be another leader in the not too distant future. There is a half brother who is a general in the North Korean military that has kind of been set up as heir apparent. Nobody really evolves as a real heir apparent because in the past, Kim has executed people that he thinks are challenging him for power. This time, it may be something more serious because that person is still being talked about as an heir apparent and remains alive. So we'll see.
On the top of healthcare, we know that our hospitals are furloughing staff because they can't perform the elective, and ERs are seeing a drop in average monthly stroke and heart attack patients, presumably due to the fear of a hospital overrun with the virus.
Right.
What is the long-term range effect on healthcare sector, and do you envision we see new innovation coming as a result of this?
Probably. The healthcare sector is going to get a lot of attention going forward because as we've looked at this crisis, one of the questions we've been asking is, could we have done anything different when this started? Were we caught unprepared? Could we have been prepared? Can we learn anything from other countries? And frankly, everybody had the same challenge. Nobody saw this coming in exactly this permutation. So nobody had enough testing kits. Nobody had enough hospital beds. Some countries have caught up a lot faster than others, and everyone now is saying, well, to avoid this kind of crisis in the future, because we obviously can't shut the economy down every year, we're going to have to be aware of the need to test. We are going to need to have better hospital capabilities, et cetera. But the other things that are going to have to change are people's attitudes towards healthcare, because as you point out, a lot of people now are very reluctant to go into the hospital environment because they think that's where they might catch the disease. You have a lot of concern as to how things are being diagnosed. Early on, we didn't know for sure whether people were dying of COVID-19 or something else. And they were kind of being lumped into categories without really understanding what the actual root cause an issue was. I think you're going to see a lot more protocols revolving around healthcare. It's going to be everything from, like the TSA is discussing the possibility of taking people's temperatures before they let them pass the gate, so that if you're sick, you are denied entrance into the airport. There are bills that are now saying, well, from here on out, we're going to test people as they come into the building. We're going to restrict people visiting the building so that we don't spread the disease. There are a lot of companies that are now talking about drastically expanding their basically their sick day policies, because they want to be able to tell their employees, if you even think that you have a disease like this, do not come to work. And we're going to expand your sick leave to the point that it's not a burden. If we have to give you sick leave for 9 months, we will, because we don't want you coming into this business with the disease. So a lot more attention to hygiene, to trying to prevent the spread of something. Over time, we'll sort of relax, but this has been described as kind of the medical version of 9/11. The world changed after 9/11. We accepted additional security. And we all know that prior to 9/11, we just showed up at the airport and jumped on the plane. We don't do that now, and we'll never do that again. We are now dealing with all kinds of changes in our daily life. That's going to be now a medical issue as well. Even the whole issue of tracking and tracing, that's one of the 3 T's. Finding out where people have been and who they've been exposed to. The only way you do that is that you start tracking people's GPS on their phone. And that becomes a huge privacy issue. It's going to be a lot less popular here than it has been, for example, in South Korea.
Great. I know we're kind of running out of time. We have a bunch of questions still coming in, but I'd like to touch on 2 more subject areas if we can. The first is inflation expectations.
Right.
U.S. has more debt to income than any other point post-World War II. Does inflation play a part in the high debt load?
It probably will play a role, but not a real huge one at first. Most of the inflation is still going to be driven by commodity prices and wages. Wages will not be going up anytime soon. Commodities might by the time we get into the fall. The big threat at the debt level is not really that inflation creates an existential crisis. It's just that if there's too much inflation, theoretically, it reduces the value of the U.S. debt, the U.S. Treasury bonds. That is not expected to happen because, frankly, everybody in the world is in the same boat. The other issue is really one of when does the consumer turn loose of all the money that's been dumped in their laps. We've spent an awful lot of money as a government. It should be inflationary at some point. It hasn't kicked in because people aren't spending it. When they start to, and they have the opportunity to, we might start to see still inflation. But right now, we're still under what the Fed would prefer as far as inflation. And by the way, on questions, if we don't get to the one that you have asked, please send it to me by email. I'll be more than happy to answer it later.
Perfect. All right, real quick for our last question, can you touch a little bit on what Sweden is doing and your thoughts regarding that process?
Yeah, Sweden was kind of a lab rat of its own. The Swedes decided that they could ask their population to behave and not have to shut everything down. And for a while, that sort of worked. The average Swede was willing to practice self-isolation, all the rest of that stuff. But it became pretty obvious that without a certain amount of control, people were still engaging in behavior that was counterproductive. Sweden was under most of the European countries for a while, but now looking at fatality rates that are similar to those they've seen in France. The country that has done the best still is Germany. Germany is something like 5,000 deaths compared to our 47,000 deaths. But the Germans imposed discipline along the same time that they had sort of the cultural discipline operating. Norway was highly critical of Sweden, saying that, you know, you're dumping your problem on to us. And the Swedes have actually tightened up in the weeks since. They have closed more schools, they've closed more businesses. So at this point, they were slow to to do what everybody else did, but now they're starting to emulate all the other Europeans.
Well, great. Thank you very much, Chris. I think in the interest of time, we will wrap it up there. I hope all of you have a great weekend and stay safe, and we will talk to you soon. Thank you again.
Thank you.